knows about contraction pain. Well, at least most people know about contraction pain. But there are some other little known pains that people find really disconcerting in labor and delivery. And because I am always here to give you appropriate expectations for your upcoming hospital birth, today I want to go over some of those with you, what you can do to help with them, or just how to manage them in general. I'm so glad that you're here because so many people get surprised by these, and I don't want that for you. So let's jump into them. Okay, the one I mentioned above, contraction pain, I actually have a whole video on what contractions feel like, so I'm not going to go over it here. In fact, most people are not super surprised by contraction pain, although every once in a while I do have people surprised by it. But anyway, I'm going to link that video down below so you can watch it as well. But let's go over what surprises people. And yes, this is from 3 births of my own, plus helping thousands of patients over my 20 years in labor and delivery, plus talking to millions of people online. Some of these I'm like, oh yeah, like I should talk more about that. So glad that you guys are here. Give me a follow so you don't miss any other weird things that happen in labor and delivery. Okay, the first one that really annoys a lot of people is that once your bag of waters breaks, it just leaks fluid. And so many people are super grossed out by the feeling of it just leaking water. It's like you can't hold your own urine. It feels very similar that it's just leaking out all the time. And you know, if that were to happen to you today where you were just leaking urine just basically constantly, especially when you change positions in bed, it would gross you out. So it's not unusual for it to gross people out either. Now, your amniotic fluid is mostly made up of baby pee. The baby is drinking the fluid in there, but also you are feeding the baby through the placenta. And as the baby filters the blood that you're giving them with all the nutrients and things that they need, they are making pee. And as you can imagine, baby pee just keeps coming out. You'll find that with your newborn when they're born. So, you know, water will keep coming out no matter if we broke it. And all the water comes out, but it also kind of depends on where your water breaks. You know, if it breaks up towards the top, you get a little spillover. Anyway, people get really bugged by it, and I just want you to know that it sometimes happens. My best pro tip in this area is to ask your nurse for a pile of chucks, and your partner can change them out. People feel really embarrassed when they're asking me every time to change out the chucks. They're like a plastic sheet that just absorb fluid really well. Your hospital will have them in labor and delivery, and your partner and you can change them out like every time you get up to the restroom, or if it's just grossing them out, you change it out, and usually you just chuck the other one. So that's probably why they're called chucks. I don't know, but that can help you have something dry underneath you. And honestly, in labor and delivery, we're expecting all the fluids to come out underneath you. So it's not like we just have a basic pad there. Usually I had a couple chucks down just in case. You can also wear a pad if you would prefer, although some hospitals are a little bit weird about it. We definitely want to make sure that you're changing it at every time you get up to the restroom because we do not want any infections in that area. If you were to change it and just kind of let the bacteria build up on that pad, we don't want that, but there you go. At our hospital, if I had patients who wanted to walk around and their water was broken, I a lot of times would have put a Depends on them, and we'd wear it while we walked around, and then we would throw it away and get a new one when we got up to walk around again. Now, I wanted to title this next section is places you feel like your baby is going to come out of. And so your baby is here. And so you're like, of course it's coming out the birth canal, but your body doesn't have the best pain receptors here. You know, it's not like on your finger where you know exactly where we're touching you. In your pelvic girdle, sometimes your body gets a little bit confused as to where the baby's coming out. Some people feel like the baby is coming out their hip. Like I really thought my last baby was going to just shoot through. I don't even know what this is, your ischial spine. I don't remember what that hole's called. Maybe a foramen. I don't know. But, a lot of times people get extreme hip pain, like the baby is going to burst out their hip bone. Not unusual, annoying, never seen it happen. But, you know, depending on how baby is, as soon as my baby then dropped into the birth canal, that hip pain went away. But early on, I had a lot of hip pain, even with an epidural, because it was so much pressure in my hip area. I don't know. If you're having that much pressure, I have a whole video on what to do if your epidural is not working. Sometimes with the pressure, it's just something you have to tolerate until baby moves down into the birth canal. And sometimes it's something that they could give you extra meds to tolerate a little bit better as well. Now, the other place it can feel like your baby is coming out of is another hole. Remember, you've got 3 holes down here. You've got the pee hole, your urethra, you've got the birth canal, your vagina, and you've got your rectum or your anus where the poop comes out. And your anus might start to feel like the baby is coming that hole. It is decided to pick that hole to come out of. As you can imagine, as baby's coming down, it can actually squish that area because they're all right in there. When I check your cervix, the anus is actually just right behind it. So if baby's head is angled just a little bit more towards the back, you can feel a lot of rectal pain, and it might feel like the baby is coming out that hole. Again, have never seen it. And as baby descends more into the birth canal, which is a little bit more forward, usually that pain goes away. If you're not tolerating that pain really well, usually an epidural can be really helpful because it should take that pain away, but it's something to think about. And I always feel miserable for my patients who feel it because it's not fun. That is not an area that we want to feel a lot of pain in, or we are expecting to feel a lot of pain in. We just think we're having a contraction pain and the baby will come out our birth canal. But bodies are confusing. Now there's one other type of, it's not really a pain, but there's one other sensation that really annoys people, and that is shaking. It can happen with an epidural. It can happen during transition. It can happen after you have the baby. Lots of people have it happen after the baby, epidural or not. So it's just like you're shivering. It's the same thing, but you're not really cold, although sometimes a warm blanket, that's right, I said warm blanket, which is the best thing about being in the hospital, can help with it. The other thing that I've seen that can help is to put out your tongue. I'm guessing your body doesn't shake because it doesn't want you to bite your tongue off, but honestly, I have no idea. But that can help with the shaking. The other thing is to just try not to fight it. Just take some deep breaths and hopefully it'll go away soon. If you're having questions about the shaking, seeing if there's anything you can do, talk with your nurse to see if she can help it. But it is an experience that a lot of people get for multiple reasons, and isn't unusual. And by the way, when we go back for a C-section, a lot of time my patients shake there. I think that's from nervousness. I would definitely shake. I shaked when I signed my mortgage papers the first time. So if you're a nervous shaker, expect it in labor and delivery. Nervous shaker sounds like a religion. And as a side note, we've talked about epidural or natural birth in a lot of these situations, but I believe everyone should have some natural pain management training, and everyone should know what to expect if they get an epidural. I think it is important for everyone who's planning to give birth in the hospital or could possibly give birth in the hospital should know about those different things. I recommend a birth class that does both of them. Some of them elect to only talk about one or the other, and I don't think that's your best bet. I'll put the birth class that I recommend down below. Now, these are not the only things that are surprising in labor and delivery. I actually have a whole video about the gross things that you might find in labor and delivery or that would give you the ick. I'm going to link it up above and down below. I got to know, what other things surprised you in labor and delivery? Tell me down in the comments. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth, even some of the things you just might not expect but could happen.